This video is going to start at concussion in the chapter 12 notes towards the end, and then run you through the very end. The first 4 things that we have are already defined for you up here on the screen, so get whatever you need from up here. Other stuff that would be good for you guys to have. The more concussions a person has, the more likely they are going to suffer from personality changes as they go later in life. That's something that NFL only very recently started to admit, and there was a whole Will Smith movie about the whole thing. So if your kids do play middle school, high school football, keep in mind the more concussions they get, the more likely they are going to have a difficult life later in life. Contusion just means bruise in general. If a person gets a bruise below the cranial vault, that can increase pressure within the cranial vault, and anything that increases pressure can basically start to shut off blood flow within the brain just because the pressure is so high inside of there. And so those are life-threatening sort of incidents. Here we're talking about a contusion that's under any of the meninges or on top of the brain itself, and so those are going to be pressure problems. Hemorrhage just means bleed in general, and the notes I gave you subdural and subarachnoid, and the difference between those is which meninge is actually doing the bleeding and where is the blood pooling. Subdural means the blood is pooling under the dura mater, and subarachnoid means it's pooling under the arachnoid mater. Again, both of those can increase intracranial pressure, and so both of those can be life-threatening. You want to get treatment immediately. The final one that I gave you is cerebral edema. Now, edema just in general means swelling. Once again, that swelling is going to increase pressure, and so that's also going to need some medical treatment. Next up, you have cerebrovascular accident. This is one of my least favorite terms for something because it makes it sound so trivial by calling it an accident. But cerebrovascular accident is the technical name for a stroke, and a stroke is a very bad thing to happen to a person, so make sure you know stroke is what we usually call it. There are 2 basic reasons why strokes might happen. Both of them end up resulting in the same thing, though, and that is lack of blood flow to a part of the brain. Now, we talked back in Chapter 11 about the fact that nervous tissue is very metabolically active. It needs a constant source of blood, or it's going to run out of glucose and oxygen, and the cells are going to start to die. So, end result is tissue is dying. Okay, now the 2 reasons why that might happen. One is a person's forming blood clots when maybe they shouldn't. Those clots can get stuck in smaller vessels and then act basically like corks, so they're preventing blood from moving past them. The second reason is the person might have ruptured an aneurysm. Now, an aneurysm is a swollen and ballooning blood vessel. If it ruptures, you're bleeding from that rupture, and again, if blood's leaking out, it's not going to where it's supposed to go, so we have that lack of blood flow to an area. Now, the treatment for stroke depends on which one of those 2 things led to it. If you have a stroke because of a clotting problem, we give you a drug to dissolve the clot. One of the earlier ones was tissue plasminogen activator, or TPA, and that still gets used a lot of times. They inject that into the bloodstream. It helps to dissolve the clot, and that fixes the problem. If the problem, however, was the ruptured aneurysm, that's going to take surgery to fix, and so TPA is not going to help you at all in that case because the clot wasn't the problem. So treatment varies. Let's see, next up you have ischemia. Now, ischemia is a general term for lack of blood flow to an area. So a stroke is the result of ischemia. Heart attack is the result of ischemia. I gave you that word because it's in the next issue, which is a transient ischemic attack. Now, transient means temporary, fleeting. It happens for a little bit and then it goes away. TIAs, as they're called, are basically little mini warning strokes. They tell you that a stroke, a big stroke, might be about to happen. So if you have a person who appears to be suffering from TIAs, it means get them to a doctor immediately. Probably if they're having TIAs, it's a clotting problem, and so they're going to put the person on blood thinners so that the clots can stop forming. Next up. Degenerative brain disorders means that once the diseases start, the degeneration keeps happening, and eventually it is going to lead to death. At this point, they've come a long way in terms of treatments for both Alzheimer's and Parkinson's, but none of our treatments cure it at this point. We can just slow it down. Huntington's, there's nothing they can do for you, except they can test you for it and tell you that you have it. Basic differences between them. Alzheimer's leads to dementia. Now, dementia colloquially would be like you're crazy. You're seeing things you're not supposed to see. You're having hallucinations. You're not remembering things you used to be able to remember no problem. So that's basically dementia. In terms of Alzheimer's, there's some genetics forms, there seems to be some environmental forms. Some people speculate that it's an insulin issue, some people speculate that it's a prion issue. So there's still a lot of research to be done when it comes to Alzheimer's, but at this point, again, they can help slow down the progression of the disease. Parkinson's. Now, we talked about this previously when we talked about dopamine as a neurotransmitter. We talked about it when we hit on the substantia nigra and the basal nuclei. So the problem with Parkinson's is the person's not producing enough dopamine in a specific part of the brain. Since the dopamine is the problem, we treat this with levodopa or some other form of dopamine, and that works at first. Again, there comes a point, though, where that's not working so well anymore, and so we can slow this one down, but we can't cure this one either. There are some newer treatment options that are being offered that involve stimulating areas of the brain, basically surgically. Those are still in early experimental stages, but maybe in the future they might be able to do something better for us there. Finally, you have Huntington's. Now, Huntington's is a straight-up genetic disorder. It happens to be a dominant disorder, and what that means is most people who have Huntington's, they are what's known as heterozygous. They have a copy of a Huntington gene, and then they have a good copy that doesn't cause the disease. However, because they have one bad copy of that, that is a dominant gene, so that's the gene that gets expressed, and so the person ends up with Huntington's. Now, the downside to that is even though you're heterozygous, there's still a 50% chance you can pass it on to your offspring. So for this one, there is a test. We can tell you whether or not you have it, but then there's no treatment, there's no cure, there's nothing else that we can do for you. There's arguments pro and con on the test. If you guys remember the show House from back when it was on, there was a whole story about 13, the character played by Olivia Wilde. And the story had gone that her mother had it, but she didn't want to know if she had it. Reasons why you might want to have the test if Huntington's runs in your family. You could find out for sure whether or not you do happen to carry it. That can help you complete items on your bucket list if that's the way you want to do it. It can also help inform your decision about whether or not you should have kids, because if you test positive that you have it, even though you're not showing symptoms, again, there's still a 50% chance that if you have a kid, you can pass it on to your kid. Reasons why you might not want to have it, maybe you feel like that would be a weight hanging over your shoulder that you know it's going to happen later in life, so you're not enjoying your life anymore. So pros and cons, it's a personal ethical decision, but it is a test that is out there. Let's see. Next up, spinal cord is just the connection between the brain and the whole rest of the body. It does sit within the central foramen and the vertebrae. It varies in length depending on how tall the person happens to be, but it's all the yellow that you can essentially see in that picture. The spinal cord does have the dura mater, just like the brain did, and it is continuous with the dura mater of the brain. As you look at this picture right here, they've cut back so you can see the meninges that are surrounding it. So you have the dura mater right here, the arachnoid mater right there. The epidural space is the space between the dura mater and the vertebrae. So it's kind of this empty space that you can see in this picture running right through here where the arrow is. If you've heard of epidurals, it's usually in reference to a pregnant woman who is giving birth. She gets an epidural so that she doesn't feel the pain anymore. So that needle is going right into that little sliver of space right there to put the drug into the system so she's not feeling that. Okay, that is in contrast to a lumbar puncture, which is abbreviated LP. A lumbar puncture is actually going through the dura mater so that it can collect some of the CSF. There's not CSF in the epidural space, and so they need to go below it. So I just want you guys to appreciate the anesthesiologist or the doctor who is going to be sticking the needles in these two places. Look at all the tissue they have to stick that needle through, avoiding the bones as they're doing this. The epidural goes right here. The lumbar puncture goes right here, just through a couple more little slits of tissue. So appreciate that for just a second. They're shooting through all of this tissue, and they have to know how many essentially pieces of paper they have passed that needle through, the difference between an epidural and then a lumbar puncture. It's pretty amazing when you think about it. All right, next up you have this picture. This is a cross-section through the spinal cord, just running you through 3 nerves. What I want to focus on are a couple things. First off, notice that the gray matter and white matter has flipped. Within the brain, the white matter was deep, and then the gray matter was superficial. Here, we've got the gray matter that's deep and the white matter that's superficial, so we've got to switch. Also, what I want you to notice is we've got a bunch of nerves that are running through the spinal cord proper. They are coming out to talk to various things, and some are coming in so that they can take information back up to the central nervous system. So we have all these spinal nerves that are coming out off the side. Now the spinal nerves are two-way streets, northbound and southbound, running together. Each spinal nerve has two roots to it. A dorsal root, which is the only one that has this little bump on it, that's called a ganglion, that is the dorsal root ganglion. And then there is a ventral root. Each one of these is a one-way highway. The way that it's going to work out is the ventral root is taking motor information from the central nervous system out to an effector like a muscle inside the body. The dorsal root is taking sensory information from the body up to the central nervous system so that the brain is going to be able to process that at some point. So that helps us answer the question under the picture, which way are impulses traveling in the following. For the ventral roots, it's motor information leading out towards the body. For the dorsal roots, it's sensory information coming into the central nervous system. And then the spinal nerves are both sensory and motor. It's all merged in there together. Next up, you have paralysis and paresthesia. They are defined for you right there. If a person has a transected spinal cord from, let's say, they were in a motor vehicle accident and it severed the spinal cord, these two things are going to go together. They're going to be paralyzed and they're going to have paresthesia. That means they can't contract those muscles, and if you touch them, they cannot feel it south of that injury. Here's the thing, though. They don't always have to go together. There are certain diseases where the person might be paralyzed, but they can still feel it if you touch them down in the legs if they had been paralyzed in the legs. So while they do often go together, they don't have to go together. So they would be written separately in the charts just to be super clear. Next, there are two basic types of paralysis. Flaccid paralysis is a ventral root problem. It is not a spinal cord problem. So if I come back to earlier, remember, spinal cord, you have ventral roots, you have dorsal roots. The dorsal root's job was to carry motor information out from the central nervous system to the effectors of the body. So if the ventral root gets damaged, we have no way to talk to those muscles anymore. Spinal cord still works. The ventral root being broken doesn't mean the dorsal root is broken, and so they can still be sending sensory information up. So this boy right here, he has polio. Polio specifically attacks the ventral root, which means he can no longer contract the muscles in both of his legs because that's what the virus has attacked in him. However, he can still feel those doctor's hands on his feet because the dorsal root is just fine. And so flaccid paralysis is a ventral root issue, not a spinal cord issue necessarily. Okay. Next up, you have spastic paralysis. Now here, the motor neurons are all intact. Something else, usually up within the brain itself, has been damaged, and as a result, the brain can't send the information out to the rest of the body because the brain can't send the impulse. Here's the thing, though, spinal reflexes will still be there. So if you were to go up to a person who had spastic paralysis and you were to do that little knee-jerk test, they could still have a knee-jerk response because that's a spinal reflex. That is not a brain issue. And so that's the difference between spastic and flaccid paralysis. Next up, if a person is paralyzed because of a transected or a severed spinal cord, the area where the spinal cord is damaged dictates how much of the body is going to be paralyzed. Now, last time I looked, your book did not have a picture to kind of show it, and I hadn't found a really awesome one online, but what it's trying to show you is the higher up you go within the spinal cord when you damage it, the more of the body gets lost. So if you were to damage right between C3 and C4, all of the red spots in the body up here, you would not be able to see or feel or move those things. Okay, you'd be able to see them, pardon me, but you wouldn't be able to feel or move those things. However, if you were to damage down below L1 and above L2, you would only lose the legs and you would still be able to move the arms. So that leads us to these words. Paraplegia means that you can't move your legs, but your arms are still just fine. So that would be a lower transection down here. Quadriplegia means that you have lost all four limbs, and so that would be the upper vertebrae being damaged up here so that you can't move all four limbs instead. Okay. Next up, you have spinal shock. Now, spinal shock essentially means that, let's say the person was playing football, and they got tackled really hard. As a result of that hit, they ended up having swelling in the spinal cord. Now that swelling can end up compressing the nerve so that information can't flow through them anymore. And so the person appears to have a transection because they are no longer capable of sending impulses through there, so they can't feel and they can't move. But here's the thing, it was because of swelling, it wasn't because we actually transected the spinal cord. What happens in spinal shock is if you treat it correctly, once the swelling goes back down, they're going to regain that function that happened beforehand. So everything will be just fine. It's super terrifying for a person to get spinal shock because they think, oh my God, I broke my back and I'm going to be paralyzed. But spinal shock is just a temporary thing. Next up, I showed you guys the picture of the young man that had polio earlier. So what you need to know about poliomyelitis is it's just what most people call polio. It is a viral infection that you get from drinking contaminated water. It has what's known as, and this is one of my favorite things, it's a fecal oral route of transmission, which means you have accidentally, hopefully, perhaps on purpose, ingested somebody else's feces somehow. That usually indicates poor sanitation. But because that person who had pooed in your water had polio, the polio is in the water, you drink it, and now you have polio. We have a vaccine for this. This boy is getting the oral polio vaccine. There's also a shot. The difference between those is the oral vaccine is usually a live but weakened virus, so there's still a chance that you get polio from a live weakened virus, and it does happen. The shot is a killed virus, so there's no chance that you get polio from the killed virus, and that's why most people in the U.S. go for the shot. Polio has been eradicated from a lot of the world, and this is a huge push from the World Health Organization. They are trying really hard to eradicate polio from the planet, like we did with smallpox back in the 1970s. Hopefully we'll be able to do that. The only place where polio is still endemic, or it's still found, happen to be very war-torn countries that don't tend to trust the World Health Organization or the UN in general. Think some Central African countries like Chad or Pakistan, Afghanistan. Those are the places where you can still find a couple cases of polio for that. Once you get polio, the illness goes away quickly, but the damage to the ventral root that we had talked about earlier, it's permanent. So any paralysis that you developed because of the viral infection, it's not going to get any better, but you do get over the virus, you just don't get over the symptoms from the virus. So make sure you vaccinate your kids. Okay, ALS. People have heard of this now because of the ALS Ice Bucket Challenge, and I actually just read today that because of that Ice Bucket Challenge, they have actually discovered the gene that leads to ALS, and so that's fantastic news for us. I need you to know that this is also called Lou Gehrig's disease, like it says up there, there's how you spell it, and that's because of Lou Gehrig, the baseball player, which if you've never seen it, you should go watch his retirement speech. It'll make you cry, but it's a good speech. This is Stephen Hawking. He is one of the longest lived, if not the longest lived person who has ALS. He was diagnosed back in the 1970s when he was, I think, in his 20s. I want to say it was like 21, 25, something like that. And people don't usually live that long after they have been diagnosed with ALS, but he has beaten the odds. Hopefully his doctors will help explain what they've been doing to treat him, but right now his information is personal, private, even though it's basically the British equivalent of HIPAA. He doesn't have to tell everybody what's up there. What happens with ALS is it's kind of like locked-in syndrome. You lose the ability to control, starting with your toes and your fingers, and then it travels upwards. And so even though your brain is still perfect and it still functions exactly like it's supposed to, it can't do anything outward anymore. You can't talk, you can't breathe for yourself, so they have to get hooked up to respirators. The problem with that is they tend to develop pneumonia once they're on the respirator, so that's why most people die within 5 years of having been diagnosed. Hopefully that's going to improve now that we know a little bit more about this disease. Cerebral palsy is what you guys have next in the notes. I want to say I have a slide for that. There we go. We now know that cerebral palsy seems to be tied to births that took longer than they should have. And as a result, the child was deprived of oxygen during the birth process for a long period of time. And again, we know nervous tissue, very metabolically active, it needs oxygen all the time. So because it was deprived of oxygen, some of the cells started to die. Some people who have cerebral palsy are very high functioning. I have forgotten this comic's name, I'm very sorry, but he's very funny. He has cerebral palsy, he has a job, he makes his own money. He's having what I'm hoping is a lovely life. There are other people who don't do as well with cerebral palsy. It really just depends on how much of the brain ended up getting damaged. But the moral to the story on this one is A lot of times a mom have a birth plan in place and they are so adamant about sticking to it that they don't necessarily make the best decision for the baby. So if at any point the doctor says they think it's time to do a C-section, do it, because if you don't do it, you could be putting your kid at risk for cerebral palsy. Next, disturbing picture, anencephaly and spina bifida both tend to have similar causes to them, or at least they can have similar causes. And it's the mom, while she was pregnant, maybe didn't have enough folic acid or folate in her diet. So as a result, the nervous system did not develop like it was supposed to. The difference is where the formation or the malformation occurred. In anencephaly, basically the higher portions of the brain, the reasoning circuits, and the cerebrum as a whole don't develop basically at all. Usually children that have anencephaly, it is basically a birth like a miscarriage and they don't survive very long. If they do survive the birth, they usually die fairly quickly afterwards, which is probably a mercy because they would have no quality of life whatsoever if they did survive. Spina bifida, on the other hand, is the neural tube didn't seal up, and the neural tube is an embryonic thing. It ends up developing into the entire central nervous system, but because it doesn't seal up, portions of the spinal cord in this particular case and the meningeal layers and CSF balloon outward from the spine. So this is a closed spina bifida right here. They're going to have to go in surgically and repair this. There can be varying degrees of mental instability that kind of goes along with spina bifida. After that, you have a whole bunch of Latin roots to get you through this chapter and then related clinical terms. I do want to mention or talk a little bit about autism, which is one of your related clinical terms. The diagnostic manual, I think it's called the DSM, used to list Asperger's and autism as separate diseases, but now Asperger's is classified as part of the autism spectrum. Now, when they say it's a spectrum, what that means is there are people who are high functioning and can, again, go have jobs and live relatively normal lives. And then there are people who cannot function at all in society because they get overwhelmed by the tiniest of things. We kind of alluded to this earlier when I was talking about the girl who doesn't speak, and she'll start to hum and moan and beat on things to block out just signals, stimuli that are coming from outside. And I suggested that it could be because the thalamus isn't editing or filtering information, and so that could be what some of the autistic kids are experiencing. One of the key characteristics that can help a doctor diagnose a person with autism is a lack of social skills. They don't necessarily have empathy for other people. They will interrupt you with no qualms. They can have temper tantrums that last a while, and anything can set them off. It's really hard to have a classroom with autistic people in it because they don't necessarily respect the rules of a classroom. But that said, again, I've had a fair number of autistic students, and they can be brilliant and do fantastic on a test. It's just that it can be really hard to do group work with them because they don't necessarily care what anybody else has to say about how they're doing anything. One little note to make there is they can't help it though. So even though it might seem like they're just being totally rude or selfish, they don't understand that they're being rude or selfish. And so you don't judge a person if you don't know what their condition might be. And don't judge a family that's out in town with their child who might be autistic because you might not know the story behind that kid. So even if it's a kid screaming while you're trying to have a lovely dinner with your friend at Chili's or whatever, you don't know the backstory behind anything, so don't judge people. Just try to go with it. All right. That is the end of Chapter 12, so I guess I'll see you again in Chapter 13.